Whether you're approaching your middle age or well into your senior years, health becomes a top priority. And you may find peace of mind when you take your health into your own hands. Preventative Diagnostic Centers can help you do that. Dr. John Pierce is back with us today. He is the medical director at Preventative Diagnostic Center. Hey, good morning to you.
Good morning. Thank you for having me.
Absolutely. This is a new technology, new to our valley, and actually the only one of its kind in the state at this point.
Yes,
Tell us what you're doing.
Well, we have, it's called the Siemens Somatom Go All CT scanner. The really cool part about this is it actually measures the patient before they get in this, well, when they're in the scanner, and it delivers the lowest effective dose of radiation. So we're not giving, so the small lady doesn't get the same amount that the really big guy gets, right? So, and it's the lowest effective dose to give us the most accurate scan, so we can see really, really clearly.
Exactly, and let's talk about those results of the scan. You're able to locate, to kind of early detect certain ailments. What are some of those ailments? What are we looking for here?
Well, you know, you can have dilatation of the aorta, so an aortic aneurysm, we can detect that. We can detect liver issues such as liver cancer, fatty liver, enlarged organs. We can look at the pancreas, see if there's any abnormalities of the pancreas. We look at the lungs, we can find nodules down to like 1 millimeter.
Wow.
You know, so there's a lot of different things that we can look at. Enlarged lymph nodes, kidney stones, gallstones. You know, so a lot of these things may not be presenting as a problem, but they may later on. So it's great to see it and then know, hey, listen, they told me I had these gallstones and I'm starting to have pain up here. I probably should go see somebody now.
Absolutely.
Right? You know, now you know, kind of know what to expect.
Yeah, and I love your outlook on this. I asked you before we started, I said, is it ever difficult? Because your job is to call patients afterwards who do have something on their scan that is a concern. I said, is that ever a difficult job? You said, no, actually, it's amazing because I get to, you know, alert them that there's something they can do here.
Right. I have a more positive approach to it, you know, so I've had people with calcium scores of 1,600, 400 is considered high, right? So they're not having any acute problem, but I'm like, hey, we got to get you in to see the cardiologist. Your primary care should get you there because they're going to want to do some further testing and possibly and hopefully be able to do an intervention to prevent that problem from occurring, like the heart attack.
Right. And with heart attacks, with things like breast cancer, you know, there's so many different ailments out there that early detection is the key. Well,
absolutely. If you look at cancer, right, 70% of cancers are found in the later stages. Under 30% are found early. But we find that the earlier you find them, the better your prognosis. So we can find things and get you pointed in the right direction to be able to, I hate to use the term nip it in the bud, but that's what we want to do.
No, let's nip it in the bud. I love that term.
Absolutely.
Absolutely. And you know, you have, of course, your medical perspective. From a patient perspective, what that says to me is don't be afraid. I think sometimes we're almost afraid of the results. And I had a little fear. I actually went in and got a scan myself. I will not lie. For 48 hours before, I kind of had in my head, what if there is something wrong with my heart? You know, well, it's possible, and I was a little bit nervous.
But
going
what
in.
if there
it's
is?
Human.
So now you can actually take some proactive measures. I had a lady last week when I called her, she goes, I said, how are you today? She goes, I was great until you called, because she knew that I was going to be like the bearer, and I was like, no. I just have to tell you, there's a couple little things. The radiologist recommends that you get another scan in 3 to 6 months because there was a little nodule in the lungs. We got to kind of see what it does.
Speaking of patients, we want to hear from your patient, Lori.
Excellent.
All right, let's listen.
Doctors told me that had I not had the scan done, in 30 to 45 days, I would have had a massive coronary and probably died. So I can't express enough to you guys. Please, everybody, get a scan done. It's easy, it's quick, it's affordable, and it might just save your life because it saved mine.
Wow. Amazing. So do patients hear from you if there is nothing wrong?
No, typically we just send them the results, you know, so kind of in this world, right, no news is good news.
Yep, and a copy of your scan that you can have and take to other doctors. Special offer today for people who are like, yeah, I want that scan. Maybe you want to bring in your spouse with you and both get it at the same time.
Yeah, we're doing the heart scan with the calcium score for $125. So typically they sell that for $599, so roughly $600 value for $125. That's for the couple.
Yeah.
not one individual. So
That's incredible, Dr. Pierce.
absolutely.
Great to have you.
Thank you so much.
Yeah,
Good
thank
day.
you so much. Take advantage of Preventative Diagnostic Center's special Get a Better Look at Your Health. They're located on South Tenaya, I'm not sure yet, north of the 215. Their number, their website are right there on your screen. Preventative Diagnostic Center's a proud sponsor of the Morning Blend.